did was basically switch off some of the VA-specific functionality and add in through collaborative efforts for the kind of populations that you get outside the VA. VistA itself was developed by its doctors and nurses and programmers working over many years. In fact, the history of VistA is quite fascinating. It'd probably make a great movie. It was started out as a skunkworks project within the VA, and then eventually gained the light of day and was fully funded by the national headquarters. But it did get off to a rough start. But its birth necessitated a very collaborative approach because the VA was a very distributed health system, and programmers and so forth, so that as development took place locally, it could be shared nationally and extended and then applied on a wider scale. VistA itself isn't one program. It's a collection of many integrated, very tightly integrated components. There are over 100 of them. There are about 55 clinical applications. Matt's going to focus on, I think, 2 of them. One of them being CPRS, which is the primary graphical user interface that physicians and nurses use. So let's just look at a high level what the outcomes have been of this whole approach in the VA. First of all, the patient records available anywhere in the VA health system. As I mentioned, there were over 163 hospitals and 800 clinics, and they're scattered all over the United States, over in Hawaii and Guam and so forth. And charts are always available at the time of visit. You can there are a number of ways that you can bring in remote records and so forth and see what the patient history is, even if a veteran normally resides in New York, for example, and then shows up in San Diego for care for some reason. There's a great boost in efficiency because people aren't looking around for charts and so forth or repeating tests. There's nothing's illegible. It's all in computer form. There are many hospitals and facilities within the VA system which are paperless in terms of their daily care. They do still use paper as backup. There are methods for having some backup on paper and so forth, obviously, because systems aren't entirely perfect. But for the most part, they are paperless. And there's been a significant reduction in adverse events through point-of-care decision support, not to mention significant improvements in chronic disease management. And it might be good to give an example here that illustrates this point. Back quite a few years ago, the VA is one of the leaders in applying barcode medication administration in health systems. And the story goes that there was a nurse that was coming back from a trip, and I think she was using she was dropping off her rental car at the airport, and they scanned the barcode on the vehicle and so forth, and generated her invoice on the spot. She then got an idea that this might be a way to help avoid the administering of the wrong medication or the wrong dosage and so on to patients, and took this idea back to her IT folks in her facility, and that became the seed for developing the barcode medication administration package, which has had very, very significant effects impact in terms of avoiding medication error and so forth. Learning system, the data that VistA generates is extremely helpful for analysis, both at a local level, but at a national population health level, and it provides significant value in terms of creating that feedback loop that we've been talking about. There are about 9 or 10 research facilities that just focus on mining this data and using it to improve care processes and so forth. So let's look at some of the clinical evidence. As I mentioned barcode medication administration. That almost overnight, once it's implemented, eliminates almost all of medication error. Of repetitive procedures and so forth, and chronic disease management has gone up significantly. The VA gets measured on a number of factors. Jumped up considerably because of the kinds of tools that are in VistA. I think Matt's going to demonstrate one of them called reminders. And those are the kinds of things that that were developed by physicians, were driven by physicians and nurses and so forth. In care, it wasn't just a way to record data. And I'll skip this last point. But anyways, this data is a little bit on the is old. It's back to 2003, but there's more recent information as well. The VA, these are different quality measures. Has to report on an annual basis. And basically the story here is that the VA is outperforming the Medicare system in 18, I think, of the 20 measures that are here, and similarly, it's outperforming the non-VA health systems as well. Here's another example of quality measures relating now to diabetes, comparing the private sector and the VA. And again, the VA is outperforming in most of these measures the private health system. As I mentioned, there's a number of I have a number of articles that I can share with anyone that's interested that goes into far more detail. This is an example of the kind of, this is just a spreadsheet, but that's generated using VistA data that provides a dashboard for performance on a daily basis to different health systems. There are many more tools like this that have been developed that leverage the VistA data to measure performance at many different levels. You can measure it down to the individual, to a team, to a facility, and on a regional or national scale. And the VA leverages this kind of data better than anyone else that I know of, at least. From a financial perspective, the story is very compelling as well. We're all faced with increased pressure on budgets and costs and so on. The VA did as well. For example, from 1996 to 2003, the number of veterans that the VA was treating increased by over 75%. And the other thing is that the patient population in the VA tends to be on the older side with multiple problems and so on and so forth. And so it's a very complex and costly patient population. The interesting thing is that their budget did not increase at all from 95 to 99 and only increased about 32% for over the 6-year period that this bullet point is covering. And yet they were able to deal with that huge increase in both complexity and numbers of of patients. There's been a significant reduction in waste, obviously through being able to avoid duplication of tests and so forth. They've eliminated prescription shopping, which was a problem that was occurring where veterans were getting prescriptions filled at multiple sites. And they've shifted a lot of the cost out of the system by reducing inpatient admissions and improving chronic disease management and going through to care outside in clinics rather than inside expensive hospital facilities. And that's one of the reasons they've been able to close close many hospital facilities and so forth and reduce their costs. This graph just gives you paints a picture of how the VA has been able to basically keep their costs flat compared to the Medicare program in general and the Consumer Price Index. Very recently, there was a study done on the in Health Affairs. It was reported in Health Affairs on the return on investment of the VA to the VA for developing VistA, and their estimate was over $3 billion in cumulative benefits after having invested in VistA over these many years. So I'm going to wrap up by just giving you an example of the whole paradigm being taken and applied somewhere else. I've been working for the last, I worked for the last 3 years as chief advisor to Jordan's National eHealth Initiative, which is an open source initiative to build a national eHealth infrastructure. WorldVistA EHR is the foundation of that thing. Is just an inexpensive software solution. They saw this opportunity to apply the same kind of thinking, systems thinking and ecosystem or feedback loop approach that the VA has developed across the national health system. Of course, this requires implementing the software first and getting the infrastructure in place, which is what Jordan's been doing. They're actually going live now in their pilot sites. But they noticed some very immediate effects in terms of cost, for example. The cost of the technology infrastructure was literally a fraction of what comparable systems would be. The initial assessment showed that by implementing CPOE and so forth, we could experience at least 30% hard savings for medications, lab tests, film, and so on. And that's not even getting into the benefits of improved chronic disease management and so forth. So I'm going to stop there and hand it over to Matt, who will provide some examples now from VistA using WorldVistA EHR.